Hello, everyone, and welcome to the Gut Reset Summit. I'm your host, Dr. John Dempster, and today I am thrilled to introduce to you Kevin Ellis. Now, Kevin is better known as the Bone Coach, and he is featured on Forbes as an integrative health coach, podcaster, YouTuber, and he's the founder of bonecoach.com. And he and his team have helped people with osteopenia and osteoporosis in over 1,500 cities around the world get confident in their Stronger Bones plan. And his mission is not just to help over 1 million people around the globe build stronger bones, but it's also to help our children, grandchildren prevent osteoporosis and other diseases in the future so they can lead long, active lives. And that's really what our summit's about too, Kevin. So welcome to the Gut Reset Summit.
Thanks so much for having me here, John. This is going to be a great interview, super important topic, and I think your audience is going to get a lot of knowledge out of this.
I can't wait to chat with you about everything bone related and gut related, but I want to hear, I know you've got a story. So tell me, how did you get into this?
Yeah, so it's not usually your younger male talking about bone health and osteoporosis. Most people, when they think of their bones and osteoporosis, they're thinking of somebody in their family. Maybe it's a mother, a grandmother, an aunt, or somebody like that, and they saw the progression of bone loss and osteoporosis in them. And maybe it led to fractures or something like that in the future. So it's usually not the young male that they're thinking about. And for me, the reason I got into this was I was actually told I had osteoporosis right around 30 years old. And the way that all happened was that I would even take it back to before I was born. When my mother was 5 months pregnant with me, my father was told he had cancer. 2 months after I was born, he passed away. He was 35 years old at that time. And my whole life, I had this fear that I was going to follow down that path to an early grave and not be there to experience the joys of being a father or be there for my kids. And when I got out of the Marine Corps, I actually started having a lot of different health issues. I had high stress, poor sleep, low energy. Some days I could barely even get out of bed. And then I was told I had celiac disease. So I was malabsorbing nutrients. And celiac disease is that autoimmune condition where you ingest gluten, it damages the villi, those nutrient absorption centers. And my little villi, my nutrient absorption centers became blunted, right? And they weren't doing their job and they weren't absorbing those nutrients. And my body still needed these nutrients to execute its daily functions. So where was it going to get these nutrients? It was going to my bones, the largest reserve of minerals that I had. And it was pulling from there. And then I was eventually diagnosed with osteoporosis. And most people are not getting a bone density scan at 30 years old, right? A bone density scan is what tells you if you have what your bone density and quality look like. So they're not getting that at 30 years old. It wasn't any of my other physicians that said this. It was a physician's assistant who said, "Hey, you have celiac disease. Has anybody done a bone density scan on you?" And I said, "No, I'm a tough Marine. My bones are fine." And next thing you know, I was told I had osteoporosis. So that set me down the path of what do I need to do to improve my health, to improve my bones, to be there for my kids. And along the way, I realized it's not the average 30-year-old male. It's the woman 50, 55, 65 plus that gets told they have osteoporosis and they're presented with take some calcium, take some vitamin D, go for a walk. Here's your bone medication. We'll see you in a couple of years for your next bone density scan. Good luck. All right. That's the standard recommendation. That is woefully inadequate. And that's the reason why I created bonecoach.com, built out a team of experts, became a health coach, developed a program, and we've now helped people in over 1,500 cities around the world. And we have over 150,000 people in our community at this point.
That's incredible, Kevin. Thank you for doing all of that. I mean, that's what an undertaking, right? Wow. And such a story. Nobody's going to look at you and say, "Hey, there's a risk for osteopenia or osteoporosis in that guy," right? This is why bone health can be very deceiving from the outside looking in. And I know we're going to get into all that today, hence the connection to the gut and how that's so important. But I mean, what a blessing that you got that diagnosis when you did, because as we all know, celiac can lead not only to bone issues, but to many, many other issues as well.
Yeah. And, I view it as a blessing in disguise. Like I was supposed to get this diagnosis. I was supposed to go down this path. And, I I was supposed to be the one to help other people become their shepherd, to help them on their journey to stronger bones, and to help them, realize that there is a lot you can do. You don't just have to succumb to the recommendations of a couple very basic things that are inadequate, in my opinion. And we can talk about some of the very specific actionable things today that people can start doing to make progress in their bone health too.
Let's do it. And I think what we should do is let's kind of define, and most people I think have an idea of what osteopenia and osteoporosis is, but can you really break it down in layman's terms? Just let us know what the difference is and really what is going on with those.
Absolutely. So osteoporosis literally means porous bone. It's a condition characterized by either not enough bone formation, excessive bone loss, or it's a combination of the two of those things. And in osteoporosis, both your bone density and your bone quality are reduced, and that's going to increase your risk of fracture. The way you find out you have osteoporosis is through what's called a bone density scan. That's a DEXA scan, is what it's also called. And that's dual energy X-ray absorptiometry, painless test, kind of like an X-ray, very low levels of radiation. But you lay down on the machine, it does a scan, it tells you your bone mineral density, the actual mineral content of your bone. And then it generates a score. And that score is called a T-score. And if you are +1 or -1 or somewhere in there, that's considered normal, healthy. If you're -1 to -2.5, that's considered osteopenia, which is like a precursor to osteoporosis. We would call that low bone mass. And then -2.5 or lower, so -2.6, -2.7, so on and so forth, that's considered osteoporosis. The greater that negative number becomes, the more severe the osteoporosis. Now, most people are not getting these scans until they're 65 years old, right? Or maybe after they hit menopause, if they're a woman, they might have a doctor who's on the leading edge, right? That does one of these scans. But I always recommend people get them earlier, just so you can understand where your bones are right now. Get a baseline, right? And the other part of this too is understand that a bone density scan, it doesn't give you the whole picture. It only gives you part of the picture most of the time. So a bone density scan looks at your density, the actual mineral content of your bone. Bone quality is the structural integrity of that bone, the microarchitecture, how that bone is organized. Those two things combine to create bone strength. A lot of times you only have the density part of that picture. Now, you can ask the facility if they have something called TBS capability, trabecular bone score capability. If they do, that can help you understand the quality side of your bone also. So the microarchitecture and the structural integrity, you can get that picture. There's also another technology called REMS, radio frequency echographic multispectrometry technology. That can also look at your bone density, your bone quality, and give you what's called a fragility score and a predictor of fracture. So there are tools that you can use to understand where you're currently at. But you also should understand that whatever your bone density score is today, it is a snapshot in time. It does not mean you are actively losing bone right now, present day. There are ways, like part of it could have happened when you were younger, right? Part of it, 90% of your bone mass is put on by the time you turn age 18.
Mm-hmm.
The remaining 10% approximately fills in by the time you turn 30. So if when you were younger, you had poor diet and nutrition, if you ate a bunch of sugary soft candy or sugary soft drinks or whatever, or maybe you didn't get a lot of calcium, vitamin D, magnesium, vitamin K, all of those things could have contributed to you not building stronger bones when you were younger. If you led a sedentary lifestyle, if you weren't playing sports or doing gymnastics or moving your body and your bones in this short, sharp, dynamic movements to build that and lay down that healthy bone structure, that could be a contributor. You took antibiotics, right? Heavy doses of antibiotics, which could have negatively impacted your microbiome from a young age. That could have been a contributing factor. If you had an eating disorder, if you smoked or drank excessively, All of those things could have contributed to you not achieving peak bone mass and starting with what I call a full bucket. So that's another part of this too, is understand that it may not just be everything present day, including your gut health. It could be things that happened when you were younger also.
I like that you use the word bucket. We often use that term in our clinic when we measure, and we measure a bulk of nutrients for our patients, whether they have bone issues, gut issues, autoimmunity, whatever it might be. But you want to always have that bucket as full as possible, and to a certain point, of course. But that resonates with me, and probably with many of the listeners. Now, I wanted to come back to, what causes. We know in your case, celiac was the big factor. But what causes osteopenia and osteoporosis for the majority of the populace that gets it?
Yeah, so there are multiple causes. We could even touch on how gut health is a contributing factor in this picture
Yeah,
too. But
please.
let's start with there's primary osteoporosis. There are different types of osteoporosis. There's primary osteoporosis that is typically related to a decrease in estrogen in postmenopausal women. Estrogen has a protective effect on bone. As estrogen levels decrease, as they do during menopause, that causes an increase in the activity level of cells that break down bone. Then there's a whole nother cause of osteoporosis. That is secondary osteoporosis. And that is where it occurs as a result of behaviors, disorders, diseases, medications, conditions. That is where, if you are somebody who's in their 20s or 30s or 40s or 50s, or even if you are a postmenopausal woman, it may not just be hormones, right? There could be other contributing factors to that bone loss. So some of the bigger contributing factors, let's first start with medications, right? These could be a really big one. Prednisone specifically could be a really big contributor to bone loss. Now, that is, I think, a lot of people aren't educated when they start prednisone that it could be a contributing factor to bone loss. But glucocorticoids, that's what prednisone is. These are steroid medications. They're designed to suppress inflammation. They're mimicking these steroid hormones in your body. And they're used to treat conditions like asthma and autoimmune diseases like rheumatoid arthritis. They will lead to bone loss. Number one, by increasing your urinary excretion of calcium. They're going to decrease your intestinal absorption of calcium. And then also, they will, and this is the biggest one, they will actually increase the lifespan of the cells that break down bone, and that's going to decrease your bone density. So that's a big one. Proton pump inhibitors, right? A lot of times people take these antacid medications because they think they have too much stomach acid. I did the same thing for a long period of time. I took Tums and PPIs for many, many years. And the reason that's a problem is, number one, a lot of times when people think they have too much stomach acid, they actually have too little stomach acid, right? So then you take these medications, which could go on to reduce the production of or increase the suppression of your stomach acid. So this would be like your omeprazole, Nexium, Prevacid, or H2 receptor antagonist drugs like ranitidine or Zantac, right? And the reason you need good stomach acid for your gut health and for your bones is, number one, your bones are 50% protein by volume. They need amino acids. You need stomach acid to properly break down and extract these nutrients from your food. Amino acids are a great example of that. Calcium, magnesium, iron, B12. If you do not have good stomach acid, your body and your bones will be starved of these nutrients and others. So it's really, really important to make sure you've got good stomach acid production.
And how common are PPIs, right? They're everywhere. I mean, a lot of people listening to this summit are trying to get help with GERD or heartburn or whatever it might be, seemingly due to excess acid, but it's often acid that's moved into the wrong area of the stomach, creates some irritation, and ultimately we end up going on these Band-Aid approaches. But more and more docs are becoming more familiar with the impact of these, especially on bone health. So it's really refreshing to see that we're not necessarily going on these for the long term. If they ever have to go on them, hopefully it's just for the short term, but oftentimes these can be alleviated altogether. And there's so many other options before a PPI that we should be considering, in my opinion, and so that we can alleviate any downward sequelae such as bone issues and many other issues linked to those deficiencies. So yeah, I'm glad you're bringing that up. It's so important. The other thing is, and I know we're going to probably dovetail into this very soon, but you really got me thinking about, okay, well, what is that bone gut connection? The acid levels are important, but also the impact of the microbiome on bone health too. Can you elaborate on that?
Yeah, I mean, there is a major connection between our gut health and our bone health. There are actually a couple different ways that it's connected. So I kind of first talked about celiac disease was one contributing factor for me. And with that, it was the damage that was happening to my villi, the nutrient absorption centers that were becoming blunted, that couldn't do their job, they couldn't absorb the nutrients. That is one way that your gut health can contribute to bone loss and osteoporosis. You can't absorb your nutrients, right? If you imagine your body and your bones as being like plants, in order to grow, they need nutrients in the right conditions, right? So many people focus so much on the nutrients, the salads, the smoothies, the supplements, they fail to consider the soil. Your gut is like the soil. You're absorbing almost everything here. So when you take in food in your mouth, you chew it up, you break it down into smaller pieces. It's churning that acidic mix to break it down even smaller. And then it makes its way to the small intestine to be absorbed by us, right? In its smallest form, and it's going to be absorbed by us, the plants. That's our soil. But if you have issues with your soil, or your roots are being damaged, in my case, right? Those things can contribute to you not being able to absorb your nutrients. Small intestinal bacterial overgrowth, right? Maybe you've got good bugs in the wrong place in your soil. Maybe you have bad bugs in your soil altogether, right? You just have things that shouldn't be there that need to be, you need to develop a protocol to get rid of those things. All of these things can affect our gut health. Another contributing factor here would be inside your bones, and your bones are living tissue. There's something called bone marrow. And bone marrow is this soft, spongy material that produces 95% of the blood cells in your body. These blood cells will start out as stem cells, and they'll become either platelets, red blood cells, or white blood cells based on conditions in your body. So if you need help with preventing bleeding or clotting, that's where platelets are going to come in. If you need help with carrying oxygen to the body's tissues or carrying carbon dioxide away from the tissues back to the lungs, that's where red blood cells are going to come in. If you need help with anything relating to the immune system or with fighting infections, healing wounds, or like I said, the immune system, that's where white blood cells come in. Okay. So what's really important, and this is the connection to your bones, your bone cells, the cells that break down bone, the osteoclasts, they are a form of white blood cell. So anything that's stimulating the immune system is speaking in the same language as those cells that break down bone. Where does 70% of your immune system reside? In your gut. So if you have digestive issues, it is not just a matter of, am I absorbing my nutrients? It's, are those digestive issues stimulating the immune system and fueling and contributing to that bone loss? That is the big connection right there. And that's actually the hidden one that most people don't understand.
Thank you. Yeah, that's huge. And I'm glad we touched on that because I really wanted to dive into that today. Now, look, we've got somebody that, goes, let's say, the traditional route, and they've got their osteoporosis diagnosis. They go to their doctor. What are they going to be prescribed? Now, again, I say this in a sense of there's a time and a place for everything in terms of prescriptions, but we have to understand what are the pros and cons. And so what does the typical prescription pad look like for osteoporosis today? And what are the expected pros and cons of those?
Yeah, happy to walk into this because a lot of times when people get that diagnosis, in a matter of 15 minutes, they get their DEXA scan that says, hey, you have osteoporosis. And the next thing you know, they're getting told, hey, take some calcium, take some vitamin D, go for a walk. Here's your bone medication. We'll see you in 2 years for your next bone density scan. That is woefully inadequate, right? There is so much more that we can do. And then when it comes to the actual drugs that are recommended, you have to understand these drugs have a dramatic effect on bone physiology. It's not like taking an aspirin. And I always liken their use to that old economic adage, there's no such thing as a free lunch, right? So there's a cost with everything that we do. There are risks and side effects associated with them. That's no different with these drugs. So what are the drugs that are going to be recommended? There are different categories of them. So there are anti-resorptives. Anti-resorptives are designed to slow down the activity level of cells that break down bone. This would be your bisphosphonates and your rank ligand inhibitors. Bisphosphonates would be Fosamax, Reclast, Actonel, Boniva, right? Those are your bisphosphonates. The safety and efficacy of these drugs is not really well known beyond 5 years. And as you and I are going about our daily lives, doing our daily activities, we're starting to get these tiny little micro cracks and fractures, micro damage in our bones. That's normal, right? For every single person, that happens every day. And then what happens is you have cells within the bone called osteocytes that sense that damage, and they send out a signal to these other cells. And those other cells they'll come in and they're osteoclasts. These other cells called osteoclasts come in and they scoop out that damaged bone. They said, okay, we need to become stronger. We scoop out that damaged bone. And then right behind it, it's a coupled process. You have these cells called osteoblasts. They come in and fill in stronger, healthier new bone. When you're taking some of these medications, in some situations, you can actually slow down the activity level of those cells, slow down that process too much, where you start to accumulate that old, worn, damaged, weakened bone over time. So even if your bone density, if you're taking one of these, even if your bone density is showing as higher or greater, the bone quality may not be as great, right? So that's an important part. And then another one is called, the other anti-resorptive is called the rank ligand inhibitors. And these are drugs that, this would be Prolia, right? So this drug, if you take this drug, you have to know that when you come off of it, if you come off of it, it will increase your risk for vertebral fractures, right? So you just have to be aware of that. And most people do not understand that. And also, if you are somebody who you weren't educated, let's say you're listening to this and you're like, well, I'm already taking it. What do I do now? Right? If you are somebody who's already taking it, you can't just come off of it, right? You have to actually have another medication, another anti-resorptive medication, just to avoid something called a rebound, which would actually cause that vertebral fracture, right? So you would have to take another bisphosphonate just to avoid that from happening. So I would say I can't be anti-medication, right? Kind of like you said, John, like there may be a time and a place in some situations. I am pro do everything you possibly can naturally first before considering that as an option, because so many times there's a lot more that can be done.
Yeah, I love that. That's what we have to be doing is exhausting the non-invasive approaches as much as we can before we move into ones that have a higher risk to reward benefit. But as you said, there always consult with your doc, but there's a time and a place potentially. Hopefully we can minimize the amount of those, by looking at these options first. Now, one other big area that I know you are an absolute expert in, and what I love is the topic of food, because food is brought into our body for all sorts of things. And yes, this is a gut summit, but the idea of this summit is not just about digestion. It's about the gateway to improving our health on all levels. And that's what the gut does. So talk to me about, your plan and how it works with food and what foods you focus on to heal the bones.
This is so important. I mean, number one, we first have to understand every single person is biochemically and genetically a unique individual, right? They're going to respond to different foods and supplements and dietary approaches differently. That's why we can't just say a blanket for every single person is going to work. It's not. Right? Because even within that, there's going to be different foods that could be a superfood for somebody, But if it creates inflammation in your body, it's not a health food for you, right? So you have to understand that you can make note of these things, but start there. That's the first thing, is just know that you're different than other people, and what works for them may not work for you. The second thing is you approach diet and nutrition. I always tell people, approach things with curiosity instead of expectation. If you do that, your disappointment will disappear. Anyone who's been on a health journey understands that you might come across a supplement, or you might come across a food that you're like, gosh, this is the answer. It's going to work. It's not going to disturb my digestive issues. I'm going to be able to eat this. It's going to be the best thing. And then guess what? It doesn't work out, right? But if you approach it with curiosity instead of expecting it to work up front, your progress is going to be a lot less disappointing, right? You'll be able to make progress easier, and it's going to help you build that healthy mindset as you move through. That's kind of the second piece. The next piece, tying into gut health, would be understand also just how we're biochemically and genetically unique. So is our gut health. So is our microbiome. So is the makeup of everything that's in there. So when you consume certain foods for you, they may cause digestive issues when they may not in somebody else. So keep those things in mind as you're building out your diet and nutrition plan. And that's going to help you set yourself up for success, from the start. The next part of this would be, what are some of the things that we can incorporate that are really, really helpful, right? One of the first ones would be protein. Protein is incredibly important for your digestive health, but also for your body and your bones too. So your bones, like I had mentioned earlier, they're 50% protein by volume. They need amino acids. So one of my favorite sources of protein could be, at least one that's gut supporting, would be bone broth. Bone broth could be a great supporting nutrient that you incorporate. Collagen protein can also be helpful. And then another one that I like, that those ones are pretty easy to take down. Another one would be sardines, mackerel, those and wild sockeye salmon. And if you can get them in the can, a BPA-free can, with maybe the bones in, that can be great because it's going to give you a dose of protein. It's going to give you omega-3 fatty acids, which are like dampeners of inflammation. And anything contributing to inflammation, especially chronic and long-term, that's going to contribute to and fuel bone loss and other health issues. And then the third one is that if you get them with the bones in, they have all the right nutrients that your own bones need in the right ratios that nature put them in, right? So that's why I like them. That can be a great addition. I love arugula. Arugula is a leafy green, same cruciferous family of vegetables as broccoli and kale. It's a rich source of vitamin C, vitamin K, and bioavailable calcium, right? Calcium, it's not a high oxalate green, which is great. Oxalates are an anti-nutrient that can bind up some bone healthy nutrients and prevent you from absorbing them. So that is, a lot of times people eat a lot of spinach. And if you have issues with breaking down and degrading oxalate, if you swap that spinach for the arugula, that could be a good way, a good approach. And then also, arugula is a bitter. Our diets today are largely devoid of bitter foods. And sometimes the bitter foods like coffee, some people can't tolerate coffee if they've got digestive issues currently. They may be able to bring it back in at some point, but that's one of the most popular bitter foods that a lot of people incorporate. If you have trouble with that, arugula is a great bitter food. And bitters are important because they help stimulate bile, which is produced in the liver, stored in the gallbladder. And when you eat a fatty meal, it's pushed into the small intestine. It helps you break down and emulsify those fats, like your fat-soluble nutrients A, D, E, and K. And these nutrients are important for your health and for your bones, right? So love arugula. I also love vitamin C rich foods. Most of us know the importance of vitamin C for our health. Like we hear about it all the time for just about every aspect of our health. And for our bones specifically, we need vitamin C. Vitamin C is key for developing and maintaining a healthy skeleton. Remember what I said, that your body or your bones are this collagen protein matrix upon which minerals are kind of interlaced, right? Vitamin C is stimulating procollagen, It's enhancing collagen synthesis, and it stimulates something called alkaline phosphatase activity, which is a marker for osteoblast bone building cell formation, which is pretty cool. Right. And there are some great food sources of vitamin C. We can do berries. Berries are a great source. You got a ton of antioxidants, polyphenols that can come from some of these, like blueberries are a great example, right? Raspberries. You can do huckleberries. Huckleberries actually have some of the highest antioxidant values in the berry space. You can do camu, amla. Those are some other ones, but blueberries are probably the one that's most accessible for people. Blueberries, raspberries, blackberries, those kinds of ones. Those are great sources of vitamin C. And then lemons and limes, right? Those are other sources that could be something you incorporate also. And then from a go ahead.
Oh, I was just gonna say, yeah, that's those are huge. I love those nutrients. And maybe you were gonna get there. Maybe I'm stealing your thunder, but I gotta ask, what about calcium and dairy? Where do we go with this? Do we need our milk that we're told that we need, or is that something that we can get elsewhere?
All right, this is such an important topic. Number one, again, if we go back to every single person is different, right? Everybody's biochemically and genetically unique. Dairy may not be the right approach or right thing to incorporate for some people. If you have an autoimmune condition and you're trying to put that under remission, dairy may not be a part of your plan.
Or
right?
a gut issue.
Right. Or a gut issue too, right? If you are going to incorporate dairy, right, it's not drink a bunch of milk, right? We need other benefits that would come if you're even incorporating that into your plan. So that's why you would look to cultured and fermented dairy if you do incorporate it. And again, not for everybody, but some people. And if you do, you want to look at your kefirs, or you want to look at get the best possible sources. The closer you can move it to Mother Nature, the better. The less processing that takes place, the better. And then you also don't just have to look at, most people only look at what's on the shelf in the store. And that's kind of all that they see in their view. So that's all they're aware of. But you can actually go online and find other sources of this, where you can find A2 cream, A2, like that's a different kind of protein that's less hard on the system, a little less inflammatory, easier to digest for some people, right? But you can find different variations of this, or you can find raw dairy products that are less processed. You can find those online too. So you can do searches for sheep, for goat, for camel. You don't just have to go with cow also. So yes, dairy there's no doubt it's a great source of calcium, but it might not work for your plan, right? So that's where, when I was talking about those fish earlier, sardines, mackerel, sockeye salmon, if you get the bones in, that is a great non-dairy source of calcium. Arugula, that is another great non-dairy source of calcium. Cruciferous vegetables can be another great non-dairy source of calcium. There are other ways to get these nutrients. So it doesn't, I know most people tend to go toward just dairy, but there are other options too. And then I would say too, try to do as much as you possibly can through your diet and nutrition first. Lead with that. And then supplement if and when necessary too, right? To close those gaps. So that I would say that's really important also.
Just want to finish off one part of the calcium conversation. We have a lot of patients that come to us who are vegan. And again, as you've alluded to earlier, not every diet is right for that person. So we have to always make sure that we're matching the diet to that biochemistry and genetics. What's your opinion on, if you've got somebody who's a vegan who's struggling with their bones, can they recover? Do they have the opportunity to recover? Are there more obstacles for them? Yes, we have arugula and spinach and also other greens that can give us bone building nutrients. But do you find that that's ever more of a challenge in vegans?
I will say, and I've had multiple conversations also. So we've got a very large community of people that have osteopenia, osteoporosis, and bone loss. I personally have a lot of conversations before people come into our programs for those things. I have a lot of conversations with people who have worked in osteoporosis clinics for extended periods of time and have evaluated as clinical densitometrists these scans of people. And many of them will tell you, and I've seen it too, is that a lot of people that follow vegan and vegetarian, or specifically vegan diets for long, extended periods of time, that can have a negative impact on bone health. And you can see some of the worst bone density in those situations. Part of the reason for that is most likely quality protein, right? Your bones are a protein structure. They need amino acids. And it's not like when you lose bone, it's just selectively pulling out the nutrients that are there. You have to tear down that whole structure to access those nutrients. And if you don't have the amino acids and those nutrients coming in on an ongoing basis, you're going to lose bone. You're going to lose it quicker, right? So having that high quality protein is super, super important. And then from a vegan perspective too, it's the quality of that protein is going to be a lot harder to get. You've got to eat a greater volume of food, and that's going to have a lot more fiber and things like that with it too. It becomes more challenging for sure. So there are things that you can do and incorporate. One way you could incorporate essential amino acids. A lot of those products are vegan and vegetarian, where you can get some additional aminos to help support that protein. But it's still going to be really challenging. I mean, if people can incorporate other things or they're open to it, it may be worth considering and just testing too.
Yeah, no, I agree. All right, Kevin, I got to ask about exercise. What do we need to be doing to get our bones as healthy as possible?
Exercise is so important. You can eat all the sardines and arugula that you want. You can get that gut health dialed in and have perfect poops, right? But if you do not provide the stimulus that you need for your bones to become stronger, they will not become stronger, right? The best you could do is maintain, right? And with that, you would still probably have a challenge. So you need two different types of stimuli for your bones. You need muscle pulling on bone. You need impact. The most effective interventions are going to use one or both of those things in combination. So most people are told, hey, just go for a walk, do some weight bearing exercise. I can tell you right now, walking is not enough. Mm-hmm. Walking could help you maintain bone density if you don't have an underlying root cause, but it's probably only going to be in your lower half, right? Because when you walk, what kind of stimulus is your forearm? A common place people have fractures as they get older. What kind of stimulus are your forearms getting? None, right? None whatsoever when you're walking. So you have to take these things into consideration. You do want to incorporate weight-bearing exercise. What is weight-bearing exercise? These are activities and exercises that you're doing on your feet. It's where your body and your bones are working against gravity to keep you upright, and they're placing a good kind of healthy stress on the bones. So this would be you're running, you're jogging, you're hiking, you're dancing, you're gardening, your Tai Chi, your yoga, your Pilates, your Qigong. All of those things are weight-bearing exercise. But we also have to be aware of what's non-weight-bearing exercise too. So non-weight-bearing exercise would be you're not putting that good, healthy stress on the bones. And that would be things like cycling or like swimming, for example, right? This is the same kind of thing astronauts work against in space. When their body and their bones are not working against gravity, they will lose it if they don't use it. The same thing applies. You will lose it if you don't use it with your muscles, with your bones. And it's not to say that if you enjoy cycling and you enjoy swimming, to completely stop doing those things, right? Especially if they reduce your stress, they make you happy, or they bring you joy, or you do those things with your family, right? Not to say don't ever do them. At the same time, you can't just do 5-6 days a week, swimming laps in the pool, get out and say, I'm good with exercise. You're not. You have to incorporate this next type of exercise, which is muscle strengthening and resistance training exercise. You have to bring in your resistance bands or your barbells or your dumbbells or your kettlebells or the machines at the gym. If that's where you're at, that's okay. And then you have to start doing exercises that are engaging major muscle groups too. Your squats, deadlifts, overhead presses, chin-ups, like doing some pull-ups and things like that. Those can all be great things to incorporate. And you do not have to be a bodybuilder to do those things, right? You may have heard that and you may be like, okay, wow, that is intimidating, right? I just heard deadlift. Never heard of that. That's scary. And you go on YouTube and you see a power lifter doing those things, right? You don't have to be at that point when you start out. You just, now that you know, now that it's part of your awareness, you can just go ask somebody to evaluate your body mechanics, see where you're at currently, and help demonstrate how you in your body with your injuries and your conditions can do those things safely, right? And when you slowly start progressing up from there, you'll get to the point where you're providing that stimulus you need to become stronger.
Great. We've covered a lot. Now, what other parts of your bone program do we need to know about? What are some of the other essentials that we haven't discussed?
I mean, some of the biggest ones, I mean, again, when we walk through a full program with somebody for building stronger bones, there are some other really important pieces that we consider, right? The first part of this is you have to identify and address the root cause issues of bone loss. You have to do that, right? So knowing what test to order, know how to understand those results when they come back, know that normal is not always normal. There could be other things contributing and things that need to be addressed. And then addressing those issues, addressing the underlying root cause issues instead of covering them up with just a pill, right? Or a single supplement or whatever. That's kind of the first part. The second part is the diet, the digestion, the absorption, right? Taking in the right nutrients in the right amounts, actually absorbing those nutrients. If you have overt digestive issues, there's a good chance, like if you're on this summit, right, and you're listening to this, there's probably a good chance you have overt digestive issues. Absorption could be a problem. Even if you don't have overt digestive issues, absorption could be a problem. Then the third layer is, are those nutrients making it to the cell level? All three of those things have got to line up. That's kind of the second bucket. And the third one is build. That's where we're doing things in terms of exercise, getting the right exercise plan in place, doing things safely to build stronger bones, to prevent fracture and injury. We are improving our sleep. It's pretty well documented. Poor sleep will reduce bone quality. So that's super important, right? And that is, of all the levers you can pull in your health, if you can get that one dialed in,
Totally.
right, that can have one of the greatest impacts on your health. That is when you're resting and you're sleeping, you're restoring, your body is restoring, right? You're building. So super, super important. I know you and I are aligned on that, John. And then stress too, right? You need to reduce your stress. And I'm not just talking about a sigh, while you're sitting in your car or just once a week. You need to cultivate a healthy meditation practice or prayer or something like that. And you need to do that daily. And then optimizing your hormones is also super important. And just having a positive outlook. It can be really challenging, when you're in the midst of a health issue. It can be really frustrating and can get you down sometimes. But just see yourself having, perfect digestive health, not worrying about having to go to the bathroom, and having that prevent you from going to an event, or, being able to be active and be there with your kids and your family and things like that. See yourself there, envision yourself there, and just continue to move toward that. You will make it, right? You don't have to know where every step is placed day one. You just have to know where you want that path to lead.
Evan, you're an absolute guru when it comes to bone health. I could listen to this for hours, but I know you've got to go, and I really wanted to sort of end it there. That's such a great way to tie everything in together. But before we hop, where can we find you online, and how can we learn more about you?
Well, this is such an important topic, and I'm glad I had the opportunity to share it. So everybody listening, you can always find me over at bonecoach.com. It's very easy, and that's where we've got programs for building stronger bones, right? If you're listening to this too, and you know somebody who needs to hear this about improving their gut health and their bone health, share this summit with them, number one. But there are resources out there to help people build stronger bones. And, you can always find me at bonecoach.com. And then we're on all the major social channels. YouTube, we've got some awesome video recipes that we do. We do interviews, and Instagram and Facebook too. So you can always find us at Bone Coach.
Kevin, this has been amazing. Thank you again. Really appreciate you being on the Gut Reset Summit, and all the best with everything going forward. And we look forward to seeing more of you going forward.
All right. Thanks, John.
You're welcome. Have a great day.